classified to relate to the county government. 4 issues fell under concurrent mandates of both the 2 levels of government. Equally, as that process was going on, the Kenya Union of Clinical Officers on 25th of March 2024 issued a strike notice citing 10 demands. The ministry went ahead to have a meeting with the Union of Clinical Officers with the intention to forestall the strike. And of the 10 demands from the Union of Clinical Officers, they narrowed down to 2 main demands. And that is failure of both levels of government to obey a court order that directed the government to finalize a CBA with KUKO and register the CBA in court. The second main demand was failure to enhance the risk allowance paid to clinical officers. The union wants the risk allowance to be increased from the current 3,000 to 15,000 shillings per month. And this will apply to all the clinical officers within the country. I would like to clarify that of the 14,000 clinical officers in the country, only 158 are in the purview of the national government. In the same breath, on the 26th March 2024, the Kenya Union of Medical Laboratory Officers issued a strike notice citing failure by the government to formulate and sign a recognition agreement with the union. The second issue is failure by government to confirm to permanent and pensionable all UHC staff, COVID-19 employees, UHC interns, and National TB and Lung Disease Program Fund employees. The other demands that were raised were all discussed by the Minister of Health in a meeting with them. Honorable Speaker and honorable members, the industrial action has had significant impact on healthcare services. This has resulted in unavailability and delayed in health services delivery amongst the Kenyans. It has compromised the quality of care and equally disrupted the referral system. This impact has the potential to contribute to catastrophic health expenditures and adverse health outcomes for the population. Ultimately, the country stands to lose gains made in key health indicators, including maternal health, HIV, TB, malaria, and NCDs. From our check, specialized outpatient services are significantly affected at 33%, and 25% reduction in specialist and outpatient services. So what has the ministry done in terms of the crisis that is here? I want to confirm that the ministry has categorized this into 3 issues: short-term measures, which we are already working on it, medium-term measures, and long-term measures. In the short-term measures, the ministry has already posted interns in lines with the SRC advisory. 1,270 diploma clinical officer interns have already been posted, and they have reported in their areas of posting. Posting letters for 1,210 medical officers, pharmacists, and dental officer interns have been sent to the respective interns, and their names have been published in the newspaper to inform them of their places of posting, and it is expected that then they start reporting from the 15th of March, which is 2 days ago. The next cadre of interns, that is the nursing officer degree and clinical officer degree, their posting letters are ready, and as we speak, a number have started picking them. The ministry has also requested for 267 million for payment of postgraduate registrars' fees arrears, which was an issue raised by the KMPDU and falls under the purview of the national government. I want to confirm that the ministry has received confirmation from National Treasury of release of 200 million towards payment of the postgraduate registrar fee arrears. The ministry has also requested SRC to advise on the demand by the Clinical Officers Union to have the risk allowance increase. We understand that this is going to have an impact on the overall budget, and that is why we have requested SRC to give guidelines. Once SRC gives the guidelines, then the ministry will be in a position to work towards implementation. The ministry has also requested public service Commission to review the clinical officers' career progression guidelines so that this can be communicated to them. On the medical laboratory officers, the ministry has already written to the medical laboratory officers informing them of